Oh my goodness, crazy good topic today. One that I know you all have been waiting to hear about. Deep diving into iodine. Whether you should take it, whether you should avoid it. If you have Hashimoto's, if you have a thyroid problem, if you have hormone problems, what should you do? Because really, when we look at the functional medicine community, 70%, I would say, are pro iodine, and 30% say, oh, no, don't take iodine, not if you have a thyroid problem. So we are going to break down, dispel some of those myths. We're going to give you the truth. We're going to give you science. And in order to do this, I brought on my dear friend, Sara Banta, who has been on the show before. Her iodine is the one that I always recommend to all my patients. And she's going to tell you the why behind it. I just know it's kick ass and good. So this is going to be a game changer for you. And you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. But let me tell you about Sara, and then we are going to get into one of the best discussions. I've been so excited for this interview. I know you guys have too, because iodine is one of your big questions that you're always asking. So Sara Banta is the owner of Accelerated Health Products. It's her Accelerdyne that I always tell you to get. In addition to the host of Accelerated Health Radio and TV, she helps her clients and listeners reach their optimal state of health through proper frequency, enhanced detox supplements, cutting-edge technologies, and modalities. Her journey hit rock bottom about 15 years ago, suffering from Crohn's disease, hormonal issues, PCOS, which so many of us, including myself, have, and heavy metal toxicity. After Western medicine couldn't give her the answers or solutions, like many of you have experienced, she discovered natural solutions that actually worked. As she was on her journey, she was hit with her 9-year-old son's diagnosis of leukemia. It was at that moment that she knew she had a bigger calling in life to open people's eyes to the world of natural healing. Fast forward to today, where she serves her clients and listeners with cutting-edge protocols that combine scalar frequency-based supplements, Chinese medicine, healing devices, and much more to detox, reset, and rebuild their body, mind, and spirit. Sara, thank you so much for coming on. I'm so excited for today.
I am too. This is such an important topic and so confusing out there. I mean, it's just in every podcast or webinar that I'm listening to, whether it's on PCOS or estrogen dominance or endometriosis or detoxification or thyroid, there's always this, well, you need iodine, but don't prescribe it to your patient unless there are severe signs, or there's always this cautionary angle to it. And it's confusing, Amie, and it's a big, important topic.
It is. It's very important. It's very confusing and very important. I agree. Because I think our followers, our listeners are bombarded with both sides of the story. I mean, to the extremes of people telling them avoid iodine in your food. And it's like, wait a minute, time out. Let's get into the science. So anytime anyone asks me about iodine, I always say, let's get into biology. Let's look at the body first. And then we can make a decision as to whether or not to use iodine. So I'm going to give you my 2 cents and I want you to expand on it. So with iodine, we know that the thyroid needs iodine. It needs it to convert T4 to T3. So the inactive thyroid hormone to the active thyroid hormone. Every cell in our body needs iodine. It's vital for our immune system. So now what else am I missing? I mean, to me, that's enough to say, hey, we should probably use some iodine, but I want you to expand on that.
Okay, so this is the crazy part. We know that our thyroid needs iodine, right? And we know that the TSH is a signal from the pituitary to the thyroid. TSH is a pituitary hormone. Yes. It's not a thyroid hormone, right?
Exactly.
So we need a certain amount in the thyroid, but we need 4 times that amount just in the breast tissue. And then beyond that, 100 trillion cells in the body need iodine. So this was a question that came to me from a client, and I actually forwarded it to you, Amie, about Sara. My TSH went through the roof after I started taking uric iodine. My doctor says it's the fault of the iodine, but I'm actually feeling better. So number 1, always listen to your own instinct. How do you feel?
How do you feel?
Right?
Yep.
Okay. It's just the same when someone gets put on Thyroid and their levels are normal, but they still feel like poop. Yep. Well, what does that tell you? It's not working. Okay. Right. So what happens, and this, I wanted to get this out right off the bat, is that you start taking the acceleridine, which is a monoatomic iodine supplement. Most iodines, which I'm going to get into in a minute, are diatomic and they're hard to break down or they're toxic of some way. The acceleridine is 1 molecule of iodine, has 100% bioavailability. So you start taking it, it wakes up the thyroid. And oh my goodness, the pituitary says, wow, we just woke up. We just got something that not just the thyroid needs, not just the breast tissue needs, but 100 trillion cells in the body need. So we are going to jack up that TSH until the whole body is happy. Now, why does the body even need more than ever? Is because the acceleridine, or the monoatomic form of iodine, not only feeds the cells the proper amount of iodine it needs, but it's kicking out those halogens, the fluoride, the bromine, and the chlorine. Okay, so let's go back to why our doctors are saying that we need to be careful with iodine. Okay, I get it. There are some side effects, but why are you having a side effect? Because the iodine's coming from a toxic source. Fukushima and Chernobyl has radioactive, made all iodine in the sea radioactive, or a lot of it. So you might be taking an iodine source that is actually toxic to your body as you are trying to detox your body from the same thing that it is feeding your cells.
Very true. Because a lot of people will take a kelp supplement, or I've even heard doctors say, I'll just take a kelp supplement. Like, no, no.
Or go eat sushi. I heard that the other day. I'm like, okay. But then the other problem is most other iodine supplements, and I don't want to name names, but the popular ones, the ones that you're hearing everywhere, are diatomic. What does that mean? That means two atoms that have been bound together, and they cannot be dissolved by water. So one cheap way is to add 75% potassium iodide to a 25% of a diatomic iodine in the water. This creates a solution, and it only has 10 to 20% absorption rate. So number one, how much are you really taking, and how much is your body actually using? And is the other atom toxic? Or maybe you have an allergy to that and not actually the iodine. And so you get the tablets, the capsules, the gel caps, all of these different forms that could have problems with them. So the other thing to remember is the unbound iodine molecule. The one atom of iodine is the only form of iodine that is needed to synthesize thyroid hormone. So you have to break apart those other iodine molecules for it to be used in your thyroid. And we're talking about people who already are lacking energy and lacking energy at the cellular level, so low ATP, and don't have that energy, that expensive energy to break this apart. And so with that iodine in the unbound iodine minus form, or I minus form, like acceleradine, it is 100% just easily just soaked up into those cells and kicking out those toxins, kicking out that radiation as well. And the iodine side effects of other iodines, okay? So some of them have contrast medias that are used in nuclear procedures, such as radioactive iodide or non-radioactive iodide. Seafood could be have plastics in them, chemicals in them, mercury, all of these other toxins that are complicating the absorption of the proper amount of iodine. And so the allergies aren't from the actual iodine. The allergies are from another ingredient in it, or just having a hard time breaking that apart. So that I wanted to get out of the way. But why we need iodine? It hydrates the body just on its own. It literally forms water in the cells, intracellular and extracellular, and it absorbs 3,000 times more ionizing radiation compared to your normal human tissue. 3,000 times. Okay. Wow. So we are, I mean, how much radiation are we being exposed to right now?
Right now, as we speak, you and I are being exposed to a lot.
Right. I've got my cell phone next to me. I'm on Zoom with you. I've got my computer. I've got an iPad over here. I've probably got a 5G tower at the end of my street, my smart meter outside of my house. And that's not mentioning all of my kids and husbands' iPads and phones that are around me.
Yep.
Right.
Exactly.
So we are being exposed to so much. And that radiation has also been said to be in certain things that are going around as far as viral activity in this day and age as well. So our bodies are needing to kick out radiation as quickly as it comes in. That radiation is scrambling our DNA. And when I explain radiation to someone, I say, well, just imagine your brain is like fluctuating at a frequency, and your brain waves are trying to keep up with it, and it can't, and it's trying to match it. And that's why you're not sleeping. That's why you're anxious. That's why you're depressed. That's literally a lot of the issues right now. People's hair's falling out, and hair loss is a huge part of thyroid issues, but it's made even worse with what's going on right now.
Yep.
So iodine, which we talked about last time, it fights most pathogens. It was used during the 1918 Spanish flu pandemic as an antiviral. It's antifungal, antiparasitic. Well, the reason it's antiparasitic, which I found fascinating, is that it kills the parasites in the gut, and parasites eat your serotonin. And that's why iodine is so important for depression and mood disorders. One other thing that's really cool about iodine is that if you have scar tissue on the outside, and it does this on the inside on its own, but if you have a scar on the outside of your body, you can mix castor oil and iodine and use a scrubbing technique over that scar to break up the scar tissues. Scar tissues are where parasites love to hide. So you're getting rid of the parasites, and you're getting rid of the scar tissue as well. And we know iodine is necessary for thyroid health and metabolism and at the cellular energy level.
Mm-hmm.
And your patients are very well versed in this, that the 4 and 3 stand for molecules of iodine, but that conversion also happens in the liver. That's why I'm huge on liver detox, because
Mm-hmm.
you got to love your liver, especially with everything that's going on, right?
Absolutely.
So it creates that function known as healthy apoptosis, the dying of diseased and programmed cell death. What is programmed cell death? What period of time do women go through the biggest programmed cell death? When they're pregnant, right? That baby goes through apoptosis over and over again. And then one of the biggest questions I have is, well, I've got a client or a friend that is pregnant or is nursing. Can they take your iodine? Yes, yes, and please.
They need
because
to. Yeah.
They need to more than anybody, because it's also connected or correlated with mental retardation and helping improve IQ. So iodine is really important for our kids. And as I mentioned, it increases mood. It increases that brain function. It lifts the brain fog. It opens up your pineal gland, or your connection to your higher self. Essentially, your thyroid in Chinese medicine is the bridge between your brain and your body, right?
Makes sense. Yep.
That bridge, you are connecting yourself to your higher self, whether that's God, the universe, whatever or just opening you up, right? And so you are able to think better. Iodine's deficiency activates each mitochondria to produce 18 times more brain cell energy. 18 times, not 18%, 18 times. And that's why it's so important for IQ and the clarity of mind. And they were saying that pregnant women have children with 13.5 points higher on the IQ test when they've been taking iodine.
Well, I've been saying just the rates of autism, I think, are increasing. Of course, we have more autoimmune, we have more toxins, and coming back to the liver, you have to love your liver to get rid of the toxins you're exposed to. But low iodine levels in women walking around with low thyroid function and low iodine, I think is contributing to the rates of autism that we're seeing, or just developmental delays in general, if you don't want to label it autism.
Absolutely. It for sure is. I mean, and it triggers DNA repair. This is what's so exciting too. It's been shown to reverse the damage to the DNA by the mRNA, the spike proteins, and the graphene oxide. And so that is huge right now. There have been so many podcasts and talks about long-term effects from the virus. Whether you had the vaccine or not, doesn't matter, just the long-term effects, and everyone's feeling it. And we mentioned hair loss, lack of energy, lack of motivation, insulin resistance, and insulin just drop. I've seen a whole change in female hormones, and I mentioned endometriosis, estrogen dominance. Guess what? One of the main supplements they are touting for helping with endometriosis, iodine. It's amazing. But it's, of course, when you think about it, doctors that are talking about that are also very cautionary about how much iodine to take. So they'll tell you that it's important and that it's found in women with endometriosis. They're found to have a deficiency in iodine, but they're very skeptical on telling you to take it. So they're afraid of how to tell their patients to deal with the iodine issue. So that is one thing that I found very interesting. And the acceleridine is so great because it has that 100% bioavailability, but the iodine decreases estrogen in the receptor sites, which will help reverse estrogen dominance and endometriosis. And it also helps with fibroids, PCOS, and other issues related to hormonal balances. So when you get into estrogen dominance, which it seems like it affects everyone, even men, this was right. This is really interesting because I have clients where their testosterone levels are fine, but their estrogen is high. And in a man, that's man boobs, that's lethargy, that's a lack of being able to build the muscle because you need that testosterone. You need more testosterone than the estrogen. So you might have plenty of testosterone, but if you have estrogen dominance, then it's not going to do you any good.
Right.
And so the iodine is going to help stabilize blood sugar, improve insulin sensitivity, increase mood, increase physical and mental energy. All of those things are going to improve symptoms of estrogen dominance, endometriosis, PCOS, all of these symptoms. And we all go back to the problems with aging come down to insulin resistance and toxicity. So let's talk about the toxic part. We need to kick out not just the radiation, but the halogens. And those halogens are what are causing the estrogen dominance, the plastics in our food. And we'll talk about salt in a minute, but just on salt is alone, 36 out of 39 salts that were tested have microplastics in it. So you're not even salting your food with salt. You're salting it with stripped away sodium, right? With plastic. Doesn't even taste like salt. So that is really important. And then you've got the chlorine and the fluoride in your water. You've got the bromine. You know, I get told we're in California. And whenever we have a fire, we have a lot of fires out here. What are they dumping on the fires? Bromide. What are they putting? So we're breathing it in. And we're being, you know, I feel water retention when it happens. And I'm on the ocean or close to the ocean. So I'm not really close to the actual fire. But even though it's miles and miles away from me, that stuff is coming in my air and I can feel it in my body. And why am I retaining water? Because my body is trying to encapsulate those toxins and somehow get them out through my liver and my kidneys. Back again to the importance of detoxification for your kidneys and your liver.
And the liver.
Right?
And those halogens are toxic to the thyroid. Those are the three biggies that we have to avoid for the thyroid. Chlorine, bromide, and fluoride will kill. I mean, it will destroy your thyroid gland.
Absolutely, because if your thyroid is not filled with those iodine in those iodine receptor sites, those other three are going to be filling them up. And not just in your thyroid, but in your breast tissue, in your whole body, and back to those 100 trillion cells in the body. And that is why it's so important. So where it gets in trouble is the failure of today's thyroid tests. The doctors test some, and you talk a lot about this, just maybe T4 and TSH. And if they're pushed, they may test the T3 and the reverse T3, reverse T4, all of the others. But they miss the adrenals that secrete T4 and T3. And the iodine is displaced by the fluoride, the chlorine, and the bromine, and the radioactive iodine from its rightful receptors, rendering that T4 and T3 useless. So they show a false normal, possibly masking the overworked adrenals and the malfunctioning thyroid. So by the time it becomes a thyroid issue, it's too late and the adrenals are already exhausted too. So a lot of people that are coming to you saying, I am tired. Do I have hypothyroidism? Well, maybe they're borderline, but they're for sure tired because their adrenals are working really hard to make up the backup T4 and T3. And so the thyroid hormones kick on from the thyroid in the morning, but the adrenals kick in at 3 in the afternoon. And so you're getting this false sense of what is T4, what is the right number of T4 and T3. So
And we
before
have to have that conversion too, because since T4 is inactive, if it's not converting over to T3 through the help of iodine, then you just have a bunch of inactive thyroid hormone, or it's going to convert, like you said, to reverse T3, and you'll just have the brakes on. So you need that iodine molecule to convert over to the active thyroid hormone.
Exactly. Now get this, Amie. Before 1973, the most accurate thyroid test for decades was the basal body temperature, right? And we know about that because us women, when we're trying to get pregnant, take your temperature. Well, you had to take it with the mercury thermometer, not these new thermometers. And if it was 97.8 to 98.2, then you were hypothyroid. Okay. Mm-hmm. Every degree triggers 556% increase in white blood cell production. So if you are low or hypothyroid with your basal temperature, your white blood cell production is down. So let's forget the thyroid and energy and weight gain issues. Our immune system is suffering. Right? So it's not just about thyroid and energy, but symptoms of iodine deficiency. You're either overweight or underweight, chronic fatigue, especially upon rising. How long does it take you to get up and get going in the morning? How many cups of coffee? Are you feeling depressed or irritable? It's not normal to be hormonal and irritable. It's not normal to have PMS symptoms. Recurring infections, muscle weakness or aches, joint aches, sensitive to cold. Are you wearing sweatshirts in bed or socks in bed? That's not normal. Cold hands and feet, headaches, constipation. I know when my thyroid is low because I'm constipated. I'm not only constipated, I'm bloated. I just don't feel like my digestion is working because that circulation is also attributed to low thyroid. You may have heart enlargement, fluid retention from your lymph. Your lymph isn't draining, allergies, dry skin, hair loss, brittle nails, difficulty breathing, hoarseness, maybe in your voice, painful menstruation. Like I mentioned, that's not normal. If you guys are having PMS symptoms or perimenopausal symptoms, that's not normal.
Right.
It's common, but it's not normal. Miscarriages, kidney functions, gastrointestinal disturbances, all of these things, bug eyes. That is a symptom of low iodine. So the other interesting thing is iodine on the intracellular produces energy. Extracellularly, it is an antioxidant, anti-allergenic, detoxifying, vasodilating. A lot of people have issues with vasodilation, right? The pumping of the blood in and out. And some people have none, where you want more constriction. Like I always tell people, if they need more constriction or more pump, quote unquote, pump in their blood, they need more calcium, but they could have a heart attack. If magnesium relaxes everything. Well, that iodine opens things up and gives you a vascular dilation. So for men, where do you think this is a big hitter?
Hey.
Erectile dysfunction. So you need your iodine. And so whenever you're talking about the female diseases, whether it's with your endometriosis and reducing the pain that you have, the pelvic pain, all of those symptoms that you have with endometriosis or PCOS, you've got to look at the male. What's it helping with the male? It's helping with erectile dysfunction. And it also helps with that estrogen dominance. So we want to get rid of that so we can actually have our testosterone and our growth hormone working for us as we're getting older. The mitochondria, as well as the nucleus of the cell, have thyroid hormone receptors. So this goes back to that 100 trillion cells that needs it in the body. So I really want to emphasize this.
Yeah.
Don't get your blood tested for 6 months when you start on the IODINE regimen.
Okay.
And when you do the regimen,
this is important. Yeah.
Yes, this is really important because the regimen, we start slow. Why do we start slow? Because as we're feeding our cells that iodine, it's waking up that TSH, but it's also kicking out all of those toxins.
Right.
And we don't want you to feel bad. That's not the name of the game.
Right.
My goal through all of my cleanses, all of my supplements, is to make them work synergistically so you're detoxing, but you're feeling great day one, right? Yep. So with the IODINE, you start with 3 drops in water 3 times a day, and you increase by 1 drop per dose per day until you get to 25 drops 3 times a day. Now that dosage seems high. Why is it so high? Number 1, we're not getting it in our food. Number 2, we need to detox heavier and more than ever before in human history because of what's going on. And I always say that whatever the world's going to give us, whatever challenge we have, God's going to give us an answer. And this is our answer. It is detoxing your body, but you want to go slow. It's really important to use the accelerated, I don't know if you can see this, the accelerated ancient salt. This is not just any salt. So we talked about the problems with other salts. This has 62 minerals in it, but it's also enhanced with scalar frequencies to detox the body and rehydrates the cells. So what happens is, okay, I'm going to get a little sciencey. The sodium iodide, it is that one atom of iodine is a co-transporter, transports iodine only into the cell, not potassium iodide or sodium iodide or any other form of iodine, just that one singlet atom of iodine. And that is why it's so important to have enough of the proper potassium and sodium for that sodium potassium pump to get the nutrients into the cells and the toxins out. And a lot of people will say, you know, the iodine, I'm feeling a little buzz from it, or a little, I've got a little headache from it. Well, that's because you're kicking out the toxins. Put a little salt on your tongue. Take a little salt in your water all day long. You need at least 1 1/3 teaspoons a day of the accelerated ancient salt. And this is going to help rehydrate the cells and help with that sodium potassium pump. I actually have one of my very best friends. She says, Sarah, I can't use your salt, or I can't use any salt. Don't tell me I need your salt, because every time I eat salt in any food, go to restaurants, I blow up like a puffer fish. I said, try my salt. It's different. And she said, oh my gosh, your salt's the only salt I can use. And it tastes fantastic. And it actually makes me feel good, right? So super important with the hydration of the proper salt. And then it also, as I mentioned, it's the only salt on earth that is enhanced with the scalar frequencies to rehydrate the cells, kick out the radiation, and detox your body in conjunction with the IODINE, which is also enhanced with those scalar frequencies to detox the body from radiation and the heavy metals. So I just said a lot there, Amie. I'm sure you're going to break it down. Questions.
We're going to break that down. So I want to back up to testing. So you said don't get your blood tested, don't test for iodine for 6 months after you start IODINE. Now, first of all, let me ask you your opinion on testing for iodine. And here's my thought. I'll throw it out there and then I want to hear yours. we can do a blood test for iodine. And again, testing for iodine is hugely debated in our community as well. Do this one. No, that one's not right. No, it's not accurate unless you do a loading test or a provocation test. So my thing is, you know what? Forget about all of that. Let's do a blood test. If you are bottomed out low, like my iodine was a 6, it's probably the lowest iodine I've actually ever seen in any of my patients was me. So my iodine was a 6. So I know from that blood work, my iodine is low. I don't care if you did a provocation, if you took my hair, if you whatever, saliva, whatever, it's going to be low. But then over time, as I'm using it and I retest and see that go up, is that an accurate indicator that my iodine is increasing? And when do people know when to stop? Because the way I'm hearing it, it just makes sense to keep taking it. It doesn't matter what your level is. To take it if it's low and in the toilet, but you don't stop taking it just because you have a higher level. Is that correct?
Right. So the regimen that is recommended for everybody, because 96% of the United States is iodine deficient.
Mm-hmm.
And so if you're not taking an iodine supplement, then you are one of that 96%. It is to do the regimen of 75 drops a day for 4 months every day, and then to drop down to 5 to 6 days a week. And until the world corrects itself and things go back to the way our ancestors lived, I would say that is an ongoing protocol. That's what I do. That's what I'm having my kids do. That's what I'm having my husband do. That's what I'm having my mom, who says, Sara, I want to do everything you can, but I'm 80 years old. I'm not going to eat what you tell me to eat. And I'm not going to do everything that you tell me to do. I said,
Right.
Take your iodine.
Right.
Take your acceleridine and I'll be happy. And so, even with people that are just really anti everything health and they're going to McDonald's every day and they're doing the standard American diet,
Yeah,
at least do the iodine. So, and I also want to go back to, how do you feel?
how do you feel?
How do you feel? Don't go off of some blood tests. I You are big on the testing, and I am big on testing as well. I do testing with a machine called the SKIO machine, and then I also have my little wristband here that's programmed with my Genius Insight app that's treating me on what is coming up for my imbalances on a daily basis. Really, really interesting. I love testing myself. My Aura ring tells me how am I doing. But how am I waking up? My sleep score is in the 90s every night. I wake up ready to go and work out every single morning with energy, and I'm ready to go. And come 3 p.m, my energy's steady. I still feel good. I'm a mom of 3. I'm a wife. I have my own business. I've got my plate full. And I could not be doing this with a hypothyroid, which I was diagnosed with. So I am doing all of the things that I know that make me feel good. And if a test is telling me, or a doctor's telling me I need to stop taking my iodine, but I feel good on my dosage, I'm going to continue.
Yeah.
And I'm going to go with what is working for me.
Well, it just makes sense because, again, as you break down the biology, what I said in the beginning, let's look at the body. Let's look at biology and what the body actually needs. And it just makes sense that the body needs iodine, just like it needs T3. With that many cells requiring an iodine molecule, why wouldn't you take it? And I'm with you, Sara. Listen, I'll test in the beginning, but after that, I'll have patients say, well, should I get my iodine retested? I go, it doesn't matter. You're just going to be taking it. You're going to take it. Now, I will say there was one time that I took, so I do uracilidine twice a day because I'll never remember in the middle of the day because I'm back to back. Like, we have crazy schedules. Sometimes I don't even walk downstairs. So I'll take it twice a day. There was one time where I was dropping it out and it went, and I put too much in it. I was like, not a big deal. And I took it and I slammed it down with my salt in the water. And I felt a little bit like I had a little too much coffee. So that's just what I tell my patients is,
Yeah.
listen, if you end up taking a little too much, like you said, you might get a little bit of a detoxy kind of feeling, like an icky, headachy feeling, or you might get a little bit hyper where you're like, whoa, okay, what's going on today?
Right.
But that was just my experience with taking a little bit too much. But if you take a little too much, or if you increase your dose and you feel like, hey, maybe that's not right for me, you just back it down again.
Yeah. And in that instance, just take a little extra salt.
Salt.
It will balance you out. So
Yep.
the combination is really helpful for people with insulin resistance and diabetes. It can actually, the salt, the accelerated ancient salt, can actually pull a diabetic out of a crisis if their blood sugar is too high. So
Okay.
this is something else I wanted to mention. I forgot to mention this when it comes to the salt. When you're not taking enough salt,
Mhm.
not only is the iodine used to clean up the thicker blood that happens over and above the vital role of mitochondrial and the cellular activity that iodine is doing, but the iodine is now then heavily used to create 7 hormones that are required to reabsorb the precious sodium: norepinephrine, epinephrine, noradrenaline, adrenaline. So let's put this together. Those are all the stress hormones that are coming from the adrenals.
Mhm.
Our adrenals need the iodine and the salt. Super important, that salt, the accelerated ancient salt, for those people that are suffering from adrenal fatigue. And I know adrenal fatigue is a controversial issue. People say there's no such thing. Well, I use the term adrenal fatigue because people are tired
People
and they
get it.
can't
Yeah.
they get it. They know what that feels like. So it is really important to have that proper salt in conjunction with the iodine.
Beautiful. When we're looking over the controversy of iodine, what I see from the naysayers are from doctors who maybe they used a very, very high dose of iodine with their patients, and there was a thyroid storm. Something happened that was very, just really not good. Like the patient crashed or they went into a hyper state, pushed from a Hashimoto's to a grave state. But that is so few and far between. And that's coming from practitioners who are using a very, very, very high dose and probably using not the right kind of iodine at a very, very high dose. So, what is your dosing with the accelerdine as compared to something like a Lugol's? And then what makes yours different too? Because that's one of the questions that we have in here as well.
So the dosage, I think in this small bottle, there's 820 servings, 500 micrograms per drop. Very concentrated.
Mhm.
Don't try to put this directly in your mouth.
No.
And that will show you how strong it is. So if you're having a reaction, the reaction is probably to the toxicity. That is, it's kicking out, it's either kicking out the toxins in your own body and you're having a Herx reaction,
Yep.
or you're having a reaction to the toxicity of the iodine supplement. And the one you just mentioned may or may not be from a toxic source.
Right.
That it's really important to know where your iodine is coming from.
Very important. Very important. So the dosing, we can't really do a kind of a 1-to-1 ratio with a Celardine and another product because they're not the same. You can't compare a milligram to a milligram in two
Right.
different iodines, correct?
Correct.
Yeah.
Yeah.
Okay.
I will not say what the dosage would be on another bottle or iodoral or any of the other iodines out there. And
Right.
I've taken them all. Just
Yeah.
everybody to know, I've taken all of them because I was taking iodine before I found this, and this just blew my mind and it changed my world when I started it.
Mm-hmm. No, I love it. I love it. I personally have never felt the detox reaction, although I've been detoxing and supporting my liver for decades now. So I might not be, but hey, listen, I live in this world. So you are exposed to
Right.
toxins every single day. I don't care how stringent you are, how strict you are with everything that goes on your body, in your body, the water in your house, the air that you breathe. You can have all the filtration systems in the world, but you're still exposed. Even eating organic, you are not 100% guaranteed that there's not a drop of pesticide that floated over from the non-organic farm next door, right? So we're all exposed to toxins. I did not experience any kind of detox reaction with yours. I just experienced good. And I always go to it if I'm getting a cold, if I'm traveling, I do extra. If I'm just feeling sluggish, I'll do extra. So I personally have experienced nothing but good.
I wanted to mention on the cold front, cold or flu or any viral, any situation. You know, I have my accelerated silver that is the #1 immune booster, and you can take it orally. You can put it up your nose, put it in your ears, spray it on your face for skin issues or what have you. But you can also nebulize the acceleridine. You put just a couple drops, but you do dilute it with water. The silver is non-diluted, but the acceleridine, you dilute it. And you can also use it on your skin if you have a wound or that you need to put. Don't put it straight on. It might sting a little bit. You would use the castor oil. But I have a lot of people that nebulize with it or even shoot it up their nose with a nasal applicator, diluted, of course, with water.
Yeah, that's great because that reminds me, I'm getting on a plane tomorrow. So in my little nose spray bottle, I'm going to put the silver and a couple drops of the iodine. I'm just going to keep squirting that my whole travel day on the plane with that recirculated air. That's going to be up my nose.
Except for you're going to have 2 separate bottles because you're not going to mix the silver with the iodine.
Okay.
No.
Okay. Because I have my nebulizer with me, so I'm ready to go there. But on the plane, I probably want to just squirt up my nose.
So the thing about the acceleridine, because it's 1 atom singlet, it is looking to attach to something. Wherever it's like, okay, where am I going to go? Where am I going to attach? And that's why it's so effective at having 100% absorption in the cells. But if it's with another supplement, it's going to attach to that other supplement.
Oh, okay.
So that's the other thing. You want to be taking the acceleridine at least 15 minutes away from other supplements or food so it can go in and do its job. So I always tell people when you wake up, sleepwalk to your acceleridine, take your dose, then go make your coffee, then sit back down and then start doing your other stuff. And that's probably enough time.
Now, what about thyroid hormone? Because a lot of my listeners on here are waking up first thing and taking their thyroid medication. Do they, with the iodine, have to wait that 1 full hour like the rule is with coffee, other supplements, other meds, food that you have to wait that 1 full hour? Do they have to wait that 1 full hour with iodine?
Well, my recommendation, and tell me if you're opposed to this, is to do the iodine first and then wait 15 minutes to do the thyroid medication.
You could do that. Most people are waking, like opening their eyeballs and reaching over for their thyroid med and just kind of popping them in, eyes half open. So that's like as soon as they get up. And some people will set an alarm and do a circadian T3 method. So they'll get up at 4, they'll take their thyroid. Well, if they're doing that, they don't have to worry about the timing. But here's my theory is you can do the iodine closer to your thyroid med than you can with other supplements because iodine is in armor. There is a little bit of iodine in armor. So we know the proximity and the fact that it's liquid, you're not going to have something in your gut that is interfering with the absorption. You're not going to have a capsule that's being broken down in your gut that's going to interfere with the absorption of your thyroid medication. I would say an easy 15 minutes to a half an hour difference between your thyroid medication and the iodine is more than enough.
Yeah. I would agree with you.
That's my thought. So Sarah, I want to get to some of these questions before I let you go too, because a lot of these are really good in here and I want you to answer them. So one person asked if it is safe to take acceleridine with Hashimoto's. You have Hashimoto's, so do I. Yep. So I'm going to let you answer that one.
You need it. You need it. You need it. So Hashimoto's, I mean, I deal with a lot of autoimmune issues, and that also you need to look at your liver and your gut, but you need the iodine. Your gut needs to be healed because hormones are made in the gut. Your liver needs to be cleansed. I have reversed Hashimoto's in a lot of clients through my Ascent Diet Cleanse. And what is that game changer is that liver flush to cleanse the liver so that your liver can do the job of converting T4 to T3. And the iodine is so important for Hashimoto. So absolutely.
Absolutely. 100%. Next person says, and I want to get to this one. Some functional medicine docs do recommend very low iodine and claim 80% reversal of hypothyroid, especially Hashimoto's, with less than 200 micrograms of iodine per day. They claim that current thyroid problems are caused by iodizing salt and increasing iodine intake among many countries that have adopted this policy. Is this just wrong interpretation of data? I'm going to say yes, because I could go off on a tangent on this one.
And this is something
strongly disagree with eliminating iodine from your diet if you are, or from your life, if you have hypothyroid or Hashimoto's. I am adamant to the point where I took down another podcast where we talked about eliminating iodine. I disagree with it so much. That's the only podcast I've ever taken down.
Okay. I want everyone to just take a step back, and I'm going to talk a little bit in code at the moment.
Yes.
The reason that they decided to do cholesterol testing is to sell statin drugs.
100%.
The reason that they are doing the PCR testing is why. The reason that they created the thyroid testing and got rid of the temperature gauge, which was the gold standard, is to do what? Maybe sell some drugs?
More Synthroid.
This is where you really have to become your own doctor. And this is where you want to get empowered. How do you feel? And I have people that come to me and they want to, oppose me. And I say, that's fine. If you don't, if you want to fight me on this, you're not my people. You're not ready to hear the message that I have. And that's fine. And at some point you will, and you will not be feeling good to the point where then you will be actually looking for the answers. But you have to think of who is making this rule, who's coming up with these standards of the blood test, and what do they really mean?
Yeah, exactly. I'm so happy you said that. And if you look at the work of, I'm going to bring up Dr. David Brownstein, still trying to get him on my podcast too. He is a medical doctor. He was practicing in Michigan, and he kept seeing all these thyroid patients come in. And if you hear him talk, he'll say, listen, I had no problem prescribing thyroid medication, but I stepped back and thought, why? Why am I seeing all of these thyroid patients come in droves? Why do so many people have hypothyroidism? Why do so many people need thyroid medication? And he dug down and he found because they're all low in iodine. So he started using iodine and got people either off thyroid medication, reduced their thyroid medication, obviously improved their symptoms, which he has a laundry list of symptoms that he has treated with iodine, including fibrocystic breast disease and breast cancer. Now, we're not going to go so far as to say it's a cure, but he has treated people successfully with iodine. So if you look at that work, there's no other data that you could show me that would trump that.
No, I agree. And I name him in some of my articles as well.
Yeah, he's like the iodine guru. Absolutely. And then last question, because I think that this is definitely, we need to bring this up. Can you take too much? Like me, if you squirt too much into the glass with the salt, can you take too much iodine?
No one's ever died from too much iodine. Your symptoms that you explained are what's going to happen. And you can use the salt to take that down or to help mitigate the symptoms, but no, you cannot.
Yeah.
It's very difficult. And like I mentioned, everyone in my family takes it. If I would give it to my dogs, if they would actually take it,
Right.
but they, you can't force an animal to, but they need it as well.
I give your silver to my dog.
I give my silver. Yep. I give my silver in their water dish every single day because they don't know the difference.
Nope.
Yeah.
Nope.
So
they do not.
It's a couple other things I wanted to make sure that I got.
Yes.
It helps with cardiac health, obviously, because hypothyroidism is connected to heart disease, correct? So
Absolutely.
that's one thing it does help with. And I mentioned that it hydrates the cells without any water, which I thought was really cool. So chemistry wise, you are actually hydrating your cells. And it can help with destroying molds, fungus, parasites, and even malaria. And it has been shown to decrease the insulin needs of diabetics. So not just helping with insulin resistance, but also helping with that as well. And I just think people feel better. They just feel better. Their brain wakes up. Their energy's better. They've got the brain fog goes away. So many things are connected to it. And when you're talking about energy at the cellular level, not the monster drink, not the caffeine, but at the cellular level, you really, it builds on itself and it has a cumulative effect. So you become a new human.
You do. You really do. It helps on so many levels. It's silly not to. It's kind of one of those, like, if you're stranded on a desert island and you're only allowed to take one supplement with you, what would it be? I mean, you might as well take iodine because it's going to help with a slew of conditions.
Absolutely.
Well, Sara, thank you so much for coming on. And I'm going to have you back on because we could go at least another hour. So I'm going to bring you back on at a later date. We'll plan this out. I love having you as a guest. And in the show notes, we will absolutely put the link to the IODINE. That's what I use. That's what I have my patients use. We have a discount code for you. So no worries. We got you connected in terms of purchasing the correct iodine. So Sara, any other closing remarks, where people can find you, where they can listen to your podcast as well?
Yeah, my new website actually is going to be posted hopefully this week. It's at sarabantahealth.com, but you can also find me at acceleratedhealthproducts.com. That's the shop, but I put all of my podcasts and all of my articles on the sarabantahealth.com and my free group coaching. Anybody can join. So if you're listening and you're like, I don't know, I'm not ready to jump all in, join my free group coaching. And Amie, I can send you the link to add to the show notes. I'm here to spread the word. I'm here to help as many people as I can. If you're listening and you've got a friend or a mom or a sister that needs my help and they just need to learn before jumping in, join the coaching. That's easy. And I do my podcast live every Tuesday at 1 p.m. Pacific, 4 p.m. Eastern. And it's every Tuesday. And it's on Accelerated Health Radio and TV, over 100 different channels. You can find me anywhere you're listening. And if you have any questions for me, email me through the website. I'm happy to answer.
Well, thank you. Thank you for all of that information, making yourself available, and just, it's all about educating and giving people the info that they need to up-level their health. So Sara, once again, thank you for coming on, and we will see you next time.
All right. Thanks, Amie.